Hello everyone, myself Dr. Saurav Bhandari, working as a consultant hair transplant at Bhandari Hair Transplant Center in Punjab. I am working into the hair transplant field since last 5 years and currently 3 centers are being run by me and my wife. A warm regards to all my fellow doctors and jumps into the hair transplant surgery. Special thanks to Dr. Arvind, Dr. Nishita and Dr. Arora. So let's begin with the today's topic about Giga sessions. Let's little brief recall about the hair transplantation. Auto transplantation technique of transferring microorgans, that is follicular unit, from one part of the body to the another. The hair follicle unit regulates hair growth by a complex interaction between hormones, neuropeptides, all those things, right? So what is the exact meaning of a Giga session? Mega sessions, what we call is 3000 plus grafts, but Giga session is minimum of 5000 grafts in a single day. Advantages of a Giga session is a type of hair transplant where we can implant a large number into area within a single session. It typically involves around 3 to 4,000, which can cover a significant area of hair loss. This allows for more extensive coverage and can be time efficient for those looking to achieve fuller head of hairs in a very short time. Hair transplant tourism relies on Giga sessions in actual. Keeping in mind the exact number of grafts and duration of the procedures may vary depending on need and expertise of the surgeon, definitely. And more benefits like it can help, more grafts can actually cover the better density for the bigger areas even. Giga sessions are cost effective to the patients. Patients which require Giga sessions that usually undergoes mega sessions usually skip their another transplant and tend to stay barred for rest of their head and rest of their life. So ultimately brings, like, people usually say that it is not being properly done because half of your head is almost empty. So it's better to perform a single session if it's possible within a given donor area, right? So coming on next is all the prerequisites. A major change I would like to ask is a 12 lead ECG for all my colleagues. 12 lead ECG is gonna give you an overview about the heart in advance, right? LFT, CBCs, all those PTINRs, Triple H. I would actually require each and every one of my colleagues to have at least a single anesthetic on board with you guys. For the reason though, all the organs would be pre-evaluated. PAC is always being done at every places, right? So better to get a anesthetic on board, so better option. Prerequisites for Giga session, luck of a patient and luck of a doctor, because definitely it's not possible that for each and every patient. A good donor actually harbors a good amount of hair. Secondly, skin softness, graft length, skin laxity, overall it will play a role. Patient should be convinced to stop wearing caps, tight clothing as soon as you interact with the patient for the very first time, because that patient might come to you after 6 months or a year, to avoid any kind of a friction alopecia. It's not a compulsion that balder person, lesser would be the donor area. We definitely see poor donors actually yield awesome results. Particularly in this case, like Novo grade 7, this donor even gave us 6,000 grafts in a single session. Over at Novo 7 have been treated. Cons of a Giga session. As per few experts and set a narrative about a single shot Giga session can exhaust completely available donor area. But in actual, it might help patient to gain confidence. For the reason we were doing long hair transplantations, it will actually give him confidence within a smaller time frame. At point when, because we need not to keep it for a future plans, we can do it right now, because when he requires the most at this age, like we need not to wait it for his coming up to 30s and 40s to give a fuller head, we can give him right away. Make sure we definitely have to keep a check on the over harvesting. We can plan Giga sessions only if we make sure that we don't have transactions and all those factors I have talked about earlier. We need not to avoid, we actually need to avoid shifting from front to the donor area. We need not to over harvest. The main point, like we were doing with the CPR program, right? It would be the worst nightmare for anyone operating having this kind of complication at the center. So definitely we should need to keep a check on local dosings. Local toxicities need to be avoided. We need to keep a check on the bupivacaine levels, LA with the areas and all those things according to the body weight of the patient, right? Main point to be considered while planning a Giga session, right? Giga session should be performed only from a single donor area. The main point to be considered, we need not to harvest 2 donor areas in a very single day. Definitely you have to keep a check on local toxicity once again. more dense into a smaller area, less dense into a larger area. That is a normal motion. But with the right technique and the right equipment and obviously the right teamwork, we can definitely go for more dense even in a larger areas, right? Today I'm gonna present a case, my case, another variety of a Giga session which included 8,000 grafts in a single session, in a single patient, right? In a single day. Now would gain one session, 1 day, 1 donor area. Especially I've been waiting to present this case from many months. I haven't even published it online. Post-streaming look marking the safe donor area, right? And this was the after, like on the very same day, 8,000 grafts being filled till the crown, even to the depth of the crown, till the occipital ridge, right? 8,400 plus grafts out basically claim on it, very much obvious. And even on the very 7th day, you can see a full head along with the temporal triangles being done, not being avoided in this case, because this case was actually having a very good density at the back. If you can see over this area, like the blackness, the density could be seen even on the before procedure, right? So, and here we go, final results. Within the next 6 months, he have a full head covered. Kind of opposite to a long hair transplantation. Within a 6 month time frame, it have been all completed. But definitely, we should opt for new options like long hair transplantation. But this patient had a good results within the next time frame of 6 months only. So no signs of over harvesting in this patient. Crown definitely takes minimum of 10 months. And no finasteride for any of my patients, only in the topical formulation of minoxidil and finasteride. No oral finasteride being provided to any of my patients. Because definitely we need to avoid the major complication that is in male patients, right? As all we know, crowns minimum take 10 months to start good results. So let's change the norm. We are not creating illusion of fear, but the actual density. Signing off, Dr. Saurav Bhandari. Thank you.
Thank you very much for a nice presentation. I will request the chairpersons to kindly honor the speaker.